Welcome everyone to a brand new video. This is Dr. Brenda Mondragon. You ready to start cracking? I know I am. But first, before we get started, click that subscribe button. Thank you guys so much for watching. Enjoy the video. So she's gonna record here. This is the mic. Go ahead and tell me what brings you to me. What brings you here?
Yeah, so I was in a car accident December of 2018, and I had a cervical sprain strain, I think levels 2 to 7. And so it's not really pain that I'm really dealing with. Like on bad days, it gets like really bad when I wake up, but it's really just like aching and stiffness. Like it's like a deep in my neck. It's not like on the exterior. Also, my lower back, I think it's always been like this since I was a kid. My pediatrician told me that I had a vertebrae that was twisted, kind of like take off a couple inches of my height, whatever. I'm not salty about it. But my other chiropractor told me that twisted wasn't really the right word. It's more like kind of like slightly turned. But whenever like I bend over, or like I stay bent over for maybe 10 seconds, it gets really like it's a lot of pressure. Not really pain, but like.
I'm up here on his atlas, the top bone in the neck. How about up here?
Yeah.
That as well?
Mm-hmm.
Okay. Then look down for me. So the first thing that I notice on him is that it's just really pulling right here on this left-hand side. Got a little bit of a compensation right here. Any pain when I do this?
Yeah.
Yeah, okay. And if I were to turn you, any pain there?
A little bit.
Any pain there?
Mm-hmm.
Yes? Okay. All right. Here we go. I'm going to discover some things as we go along, okay? Somehow your head went forward, but it went over that way. Because this is all torn up over here. Breathe. That's it. Yeah, there you go. If anything is too much, you let me know, okay?
Okay.
I just back off. Yeah, patients tend to hold their breath. Just keep.
I use a brace for the impact, yeah.
Yeah. Brace. Oh, for impact. I will warn you when I adjust you, okay?
Okay.
It. Oh. That's it. There you go. It's twitching. It's like.
You feel it?
Yeah. It's like, I don't want to. Oh, there's some scar tissue right there.
Definitely feel that, yeah.
Yeah. Here we go.
What exactly is scar tissue?
So, like imagine if your shirt got ripped, okay, and you went and stitched it back up, it would kind of be a little bulky, right? Because so it's a tear, and then your body goes in, it could be fascial tear, it could be a muscular tear, and your body puts glue in there to repair it. And what happens is the scar tissue doesn't quite move as well as normal healthy tissue. Okay, and then what happens is that you tend to tear those places again if they're not pliable. So you never tear right through the stitched part. You tear around the edges. And then the scar just keeps growing and growing and growing. So I have to make this as pliable and as flexible as I can for you so it stops tearing. So it kind of functions as normally as it can compared to the healthy tissue. That's why I'm digging, that's why I would love to not have to work so hard on people. But unfortunately, this is what has to be done. If I could just leave the scar tissue there, that'd be great. But nope.
It's gotta be gone.
It's gotta. You gotta make it. You gotta get blood in there. That's it. Clavicles feel good. So would you come for the pop-in or what?
For everything.
The cracks, for everything. Oh, okay. You nervous about anything?
Maybe about my low back, maybe.
Okay.
Because I've dealt with it for so long, I don't know really the state of it.
Okay, we're gonna figure it out in a second. All right, we're gonna go to the right side.
Okay.
Oh, yeah, right here. Is that sore? You okay?
Yeah, I'm good.
And those are your scalenes. No right arm pain?
Mm-mm.
Okay, you're still young. 19, just watch for that.
Okay.
There's definitely adhesions here.
Like running down my arm?
Yes.
Okay.
Yeah, but just be careful with your neck. You only get one spine. Here we go. Excellent. Take you back. Ooh, little pat there.
Mhm.
Free pat. Chin back for me. There you go. That was a specific adjustment.
Yeah.
Okay. So I'm pushing and I'm driving it this way. Okay. When you do that, you're just separating.
Okay. So don't do those anymore.
Not, you shouldn't. Chin back. Perfect. Perfect adjustment though. So you're not making my job harder, but it was
good.
it was a very good
Could have been
adjustment.
worse, yeah.
No, I don't think I think you're just still young enough. Maybe you
Yeah.
haven't done
Okay,
enough
that's
damage.
good. It's good to know now.
Yeah, I think you're gonna be okay. The right side though, I can tell. You must pop it or do something. Yeah. You ever thought about becoming a chiropractor?
A couple times.
The bad thing is you can't do it to yourself.
I
Once
know.
once
you know all the right things about the body.
you gotta marry a chiropractor. Yeah. You'll be their guinea pig, and then like my poor husband. Let me try. You know. I can't get all your toes. All right, other foot. Good. Yeah, so this side's a little easier. The foot that goes out is generally easier to adjust. That was easy. Tight. Gotcha, I got you, bend your knee. Wow, very tight. Okay, done. Okay, reach overhead and grab the table for me. Hip adjustments. None of them. We're gonna have to work on those.
Okay.
Okay, hands down for me. All right, now you get to go face down,
Yep.
and we don't see you for a while.
All right.
Yep. Classic. 8% right here. There's some swelling here. Just irritation, inflammation. You know, it's not like, oh my God.
Okay.
Yeah, right here. This must be what they're talking about here. Yeah, you can kind of see this outpouching right here where the muscle is pulling. And then you go and investigate. This is centered, centered, centered. And then over here we have resistance where his spine goes from here straight to now here. It's rotated this way. It's okay. It's not like, oh my God, I've never seen that before. We also have it up here too, though. Right here, here, here. About 3 of them. And you know, we have some ribs out here. Yeah, it's here and here. And I guess that is a little rare. Most of the time if we have a compensation up, we have like a, we call it a subluxation, just a curvature, okay?
Mhm.
We usually have something compensating the other way. So you have this curvature here, then here, and then it continues.
And no compensation for
There's
it.
no compensation, no. There is. It's just way down here. Here it is. So that's probably why they were like, oh, what is that? But no. You're normal. All right, you ready for the adjustment again?
Mhm.
Okay. Deep breath in. Oh, yeah. Perfect. Deep breath in. That's as hard as I'm gonna go. Skin pulling, let's get some adhesions. Okay, very good. Well, you're halfway through all the crunches, okay?
I feel so
Here's-
much lighter already.
Yeah, you do. Aw. All right, here we go. Does this tickle at all?
A little bit.
I can go harder, but I don't know if that makes it better. Yes, no.
Oh, good, yeah.
Okay. Okay. You know what? I feel one. But there's one up here. Deep breath in. Oh, yeah. I guess there was some all up
Yeah,
there.
you're right.
Like, wait, something's. Before you adjust something, the joint has a lot of. Try to explain this. It just has a funky feeling of resistance. Like it wants to move and it's not set. Yeah, there we go. That's what I want.
I can feel myself just like naturally trying to resist.
It's okay. Your hands can go back up on the thingies. I don't know what they're the pads.
Full arm rest,
Yeah, it's okay. It's not like a massage where I'm that worried if you resist, okay? Sometimes it just feels better if you can relax. That's a rhomboid right there. Piece of it. Okay. You're doing great. Try it again. That's it. This arm behind your back. Careful. There's some bars. Oh yeah, look at that. See, that's hiding. The bottom piece is fine. It's just right here. That's the trap. There. Okay, one more. Perfect. And then down. There you go. Elbow. Woo, it's getting hot. Your back is getting hot.
Yeah, I can definitely feel that, yeah.
Yeah, the heat radiating off of you. It's like, woo! You're doing great.
I'm trying.
You're doing good. You're doing really good. They're coming out. You know, they're coming out. That's it. Take a break, take a break.
I found your videos a couple months back.
Uh-huh.
After I had the RFA and the pain was coming back a little bit.
Oh, okay.
And when I would watch the videos, it would just look so relaxing. Like, the first couple of videos I would watch, I would get the same sort of relief in my neck.
Aw.
It's kind of hard to explain, but it felt like you were adjusting me.
That's it. Yeah, there you go. Tuck your chin for me. I'm gonna get this left side of his neck right here. Yeah. Yeah, there's just petechiae here. Yeah, it's just this upper trap here. He's got. It's okay. There you go. Just looks painful.
Mm-hmm.
You know, like you're going through something because you know when you look at your back when you get home, you're like, oh my god, there's a welt here. Okay, but it will go away in 7 days maximum. It's not like this where it will form a scar. It'll go away.
Mm-hmm. It's really hard for me to find like comfortable sleeping positions. My chiropractor told me to use one pillow.
We can tell you all different kinds of things.
Right.
Okay, so what you have to think of is being as neutral as you possibly can. Okay?
Mm-hmm.
So the way to sleep is just neutral. There you go.
Okay.
Pillow between the legs if you can. Don't have to, but it keeps your pelvis centered. Because when your leg hits the other leg, right, it drags the pelvis down. I don't know if that kind of, without a visual might not make sense, but. So like if I'm on my side, we tend to do this. So the low back on the side that we're sleeping on tends to blow out, tends to get swollen and irritated.
Yeah, I saw it, yeah.
Okay, so the pillow tends to shift the weight so that you're not dragging it down. You're up here. You're keeping it more neutral.
Okay.
Does that make sense?
Mm-hmm.
Kind of.
Yeah, I'm definitely gonna start doing that.
It will help. That's all. Adjust it there. This one I'm gonna have to do when you're seated, I think. Some spots here that I'm gonna get. Look down for me. Oh no, it did come out here. Yeah. It's like as time passes, it's coming to the surface. So yeah, this is the petechia here. Oh, okay. Like this is what came out on the left. Oh, is it on this side too? Yeah, you see it here. And down the scapula.
Yeesh.
Yeah. It's some out. If it's there, I'll find it. Because this is the little swollen spot that I talked about in the beginning.
Okay.
So just go ahead and lean. Yeah. Pull that open so I can get in there. That's it. There we go. Yeah, and there's another little cluster over here. How's it feeling? Okay.
Yeah.
A little looser.
Yeah, I feel loose all over, but like right now that's.
One here.
Yeah.
Yes!
Yeah, I feel that.
That's it. There you go. Okay.
Yeah. Wait. How much? Like, what does the oil do?
So I can slide and I don't tear up your skin.
Okay.
That's why I keep greasing you because I'm trying to not or I would really just To have that done dry is very painful. It's like a rug burn.
Okay.
Yeah, so I want to make sure I can slide. Yeah, this.
Yeah, I couldn't imagine doing that actually without the oil.
Yeah, yeah.
Now that I'm thinking about it, that was intense.
I know. I guess you just don't think about it unless you have it done. Or behind it. I mean, you can always say stop.
No, I'm good. I'm good.
But I just keep going until it's gone.
Yeah.
Yeah. There we go. You're gonna look up and away from me. Yeah, so I can get in there. That's it. Yeah, it's there. Oh, so this one is a little more gnarly than we thought. Glad I checked it. Well, when you were on your back and I was feeling it, you know, this must be where it broke, right there. It's healed,
Clean
though.
break, yeah.
Yeah, it's all healed. Yeah, it broke right there. So there's a little bit of trauma. You
Still
know,
there.
yeah, the muscle got a little traumatized here. Then your elbow is going to come back. Perfect. Your head goes back off. That's it. That's it. Awesome.
That was good. No, that was good.
Oh, God. Wow. On your back for me. That's just, it needed it so bad.
Yeah.
That feels. Feeling okay? Take your neck around. How does that feel? Any looser? Hopefully.
A lot looser.
Good. Lean away. You can't get too much. I think you get these.
What's it called? Crepitus?
Crepitus is that, or joint mice.
Yeah.
The
I feel that a
squeakiness.
lot in my elbows
This
too.
one?
Yeah.
Oh, it felt okay. Crepitus is like a funny grinding feeling,
Okay. Yeah. No.
which is the beginning of arthritis. There's a little bit in that left side. Be careful, because you're only 19 and you got a long way to go in life, okay? Be careful with that shoulder. Maybe don't sleep on it.
Okay.
Definitely strengthen it with exercises, but don't be lifting too much more than what the shoulder can handle.
Yeah.
Okay, take it easy until you build up the strength. Lean away, whole body. Very good. No scar tissue there. Tiny little bit. Very good. No, you must not have had too many ear infections or anything, because it's
Never, no.
no, yeah, feels good. Usually an ear infection will glue the ear, like scar tissue. It will glue it to the head.
Oh. So
Yeah.
that's what that. Okay.
And then I'm pulling it, yeah. Yep. Is my phone like completely dead, Linnea?
No.
Okay. This is the last one for him. Yeah, he just needs some of this extension. He can handle it. I'm gonna try it. I'm gonna test it.
Okay.
Do you see how his feet look like more even now? You might be a little sore. You might be probably.
I'm more sore here, yeah.
Yeah.
But once I start moving, yeah, I'm gonna start feeling it.
Okay. Oh, you have to drive him home.
Yeah, definitely taking the wheel.
Yeah, I don't want him like violently turning his head at this point.
Okay.
I mean, because it's crazy traffic out there.
That's true.
I'm gonna check in on you in a couple days, see how you're doing.
Okay.
You know, usually after all the soreness goes away.
Then we can assess.
Yeah, you're good. Drink a lot of water.
Okay.
Epsom salt bath if you need it, okay?